Let's go ahead and start tonight's presentation, as Fran is going to be our speaker tonight. So those of you that are with us, whether you're live with us tonight or whether you're watching it another time, Fran's a great speaker, and she's going to go over all this anxiety that we have. Don't watch the news. Okay, take it away, Fran.
Thank you very much, Dr. Dawn. And the funny thing is that this topic is pretty appropriate for this time. Not only dental anxiety, but a lot of the stressors that a lot of people are on. So some of the things that we're going to be talking about tonight, we can actually use in our everyday life right now. So first of all, I do need to ask, can you see me in your screen or just my screen?
Yes, I can see you.
Okay, very good. All right, so we're going to talk about relieving dental anxiety without using chemotherapeutics or using toxic anxiolytics. And there are so many things that you can do, like cognitive behavioral therapy and hypnosis and all that, but I don't want to talk about that. I want to do things that are easy to do in the office, something that the doctor can easily do takes 2 seconds, or something that the staff can do, or even the hygienist can do without involving the doctor at all. So we're going to talk about the fact that a lot of our patients are fearful to a degree, and we would love our patients to feel very calm and relaxed when they come in, but oftentimes they are not, and they're often coming into the office like this. They're white-knuckling the chair, and they're very uncomfortable. And of course, as healthcare providers, we want to make them as comfortable as possible. We feel very, we take it, we're almost like empaths. Like we take it personally if the patients are not comfortable. So we want to do what we can. So the anxious patient, you have the one that is just, oh my God, I can't stand, I have to go to the dentist tomorrow. And then you have the ones that are actually panic stricken. They are frozen in fear, and they can't even pick up the phone to make that call to call the office to make an appointment. And those are the ones that I really worry about, because if they're not coming in, we're missing massive infections. We're missing, God forbid, oral cancer. We're missing, issues that can need to be addressed for the patient, never mind just their pain and aesthetics. As we know, stress increases inflammation in the body, and increased inflammation in the body is going to have many deleterious effects on the organ systems. So we do not want them stressed more than other things in their lives are doing to them. So if we can eliminate that piece of the puzzle by using some of these toxin-free anxiolytics, it'd be extremely beneficial to them. About 82% of our patients have a level of dental anxiety, and some of them won't even tell you. That means about 5 out of your 6 patients, or like say if you have 30 patients in a day, in a larger practice, 25 of them have a certain level of anxiety. Some will tell you, some won't. So you want to be able to identify these patients, because these are the patients that are not going to accept treatment, or they're going to say, I have to think about it, or they need to go home, and I'll make the appointment, and they don't show up. So it's not about the financial part of it. It's about helping people that need help. And we want to be able to make them comfortable in our office. So here we are, about 1 out of 5 avoid dental care altogether. Completely avoid the dentist, and they will live with these massive infections, and it can affect them, and they're going to doctors and hospitals with septic issues, and they find out that it's actually starting in the mouth, because as we know, about 80% of medical conditions start in the mouth. So I feel very strongly about taking care of our patients. But psychologically, it's very difficult for these patients to get over it, because whether it is real or perceived, it's something they cannot help, because it's a sympathetic nervous system. Because in their mind, if they are creating a situation, whether it's a real fear or a perceived fear, it's real to them, and that sympathetic nervous system is kicked in, that fight or flight, okay? So they're now not able to really cognitively understand anything you're saying to them. All they're hearing is wah, 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 when you're trying to explain to them about their infection, or you're trying to explain to them about why they need to have these certain procedures to help them get well. So getting this addressed is extremely important, not just for them to get the treatment, but when they are in your chair, what's going to happen is they're going to gag. They're going to have tongue battles. I think every one of us have had tongue battles with patients, which you think you're never going to win. the lip is going and you're trying to fight against that lip and you can't get in there. They're going to have excessive salivation. They're clenching their jaw or they're not even opening. They're stalling and they're uncooperative. They're always looking for, let me just have a rinse, let me do this. And it's not because they're a difficult patient, and that's what I find bothersome. A lot of times we have patients like this and we put on their charts PITA. They're a PITA patient. We all know what that means, but they're really not. It's probably because they're scared. They're clutching and grabbing. I know I have definitely, when I was doing clinical, I've had my share of patients grab my hand. And it could be very, very upsetting for the patient and the practitioner because somebody can get hurt. We don't want that. And they have unpredictable movements. And so these are things that we all know, but these are reasons why we really need to address it. Now, this is a study that really didn't need to be done, but it was done, that we really need further training in managing these anxious patients. So we're really not very well equipped to help these patients except knocking them out, which is not really a great option, because here we have another study where it shows a lot of people are actually anxious about the sedatives. I'm going to be straight up honest with you. I personally have an issue myself. If you don't mind, indulge me, I'll give you a little bit of a story. Many, many years ago, I found out, it was the best day of my life, I found out I was pregnant with my son. It was a wonderful, exciting day, and it was the same day that I dreaded, because that meant I needed to go to the doctor, the OBGYN, which I didn't hate. I abhorred it. I hadn't gone in years because I hate it, and I have so much anxiety to go. So I said to my husband, you need to come with me to go to the doctor. And he said, of course, we're having a baby. And I'm like, no, you need to come with me and be in the room. And he's like, oh, okay. So he goes with me, we meet with the doctor. We had to find one because I didn't have a doctor. So we get there and he interviews us in the room and he says, okay, I need you to go to the exam room and get, in the gown, and we're going to do our exam. And so I slowly turned around to my husband. I'm like, you're coming with me, right? And he's like, oh, all right. I made him sit next to me. I'm draped. I'm sitting in the chair and I'm making him sit next to me. This is a true story. I reached out to grab his hand and hold his hand while the doctor was doing his exam, and I'm literally whimpering and crying out of my just anxiety of having this exam done. And then the doctor finally says, Fran, if this upsets you that much, how did you get pregnant? I'm like, doctor, it's not the same thing. So of course he was laughing and hysterical, but it was real to me how I just really hated to be there. So, and in fact, I couldn't take any anxiolytics because I was pregnant. But even so, I wouldn't have taken anything anyway because I don't like that feeling of having out of control. I don't want that feeling of having chemicals in my body. And this study showed that a lot of people are very anxious about being sedated also. So knowing exactly what your patient's fears are, not just of the dental procedures, but of how they, whatever you're going to do to them to make them feel more comfortable, it can be very critical. Because I myself, I do not want to be out of control. I don't want that. I want to be able to feel on point right away. So these things will help your patients feel that way. This is a great scale. I can send it to you, anybody who wants it, or you can just go on the internet. You can just put in modified dental anxiety scale. You can actually incorporate this into your medical histories, or part of your updates, give it to your patient, and they just quick fill it out. It's just a few questions, and it gives you an idea of where they are on their anxiety scale. Very, very helpful. Again, let me know if you want it. I'll send it to you. Otherwise, you could just easily pick it up. So here we need safe, reliable ways to manage our patient's experience. First off, of course, this is our first easy peasy way is essential oils. I mean, of course, everybody first thinks of lavender. Yeah, of course, lavender is like one of our mother oils. Okay, it's great to reduce anxiety and stress. It's anti-inflammatory, antibacterial. It's got so many amazing qualities to it. And they've done studies that show how effective it is in reducing anxiety. Here, there's a study that the laverdacent reduces a state of anxiety in dental patients significantly. Now, one thing I am going to recommend is do not diffuse lavender in your office. I'm going to tell you why. You can do it. I'm not telling you not to, but I'm going to highly suggest you don't. several years ago when I was still doing clinical, I was all excited. You know, I got my new diffuser. This is great. I got my Young Living, and I'm going to diffuse lavender for my patients because I want them nice and relaxed. So I'm diffusing the lavender pretty much all afternoon, and I'm seeing my patients. Everything is great, and my operatory door is open, and I hear my receptionists talking to each other, and they go, "Oh, I don't know why I'm so tired." And the other one goes, "Yeah, I feel so sleepy. Why am I so sleepy?" And I'm like, "Oh my God, I'm putting my staff to sleep." So I would not recommend, you know, diffusing it unless, you know, your office is that you can do such. So I'm going to give you some suggestions of how you can do it in just a little bit. You can use orange oil as a diffusion because a lot of studies are showing how orange oil is extremely beneficial in improving mood. Actually, a lot of hospitals are using it. I think Vanderbilt Hospital is using it, and they're using it to reduce anxiety and boost mood. So it's extremely beneficial to use with your patients. Here is another study suggesting that it is far superior. They did a study where they had no scent, and then they had either lavender or orange, and there was a significant difference in patients' perception of their anxiety levels. So how can we use it? Well, first of all, you can put it on the wrists. I wouldn't suggest using oil directly on the wrist. You can mix it with a little bit of coconut oil, or you have a fractionated oil. You can mix a little bit of both and can put it on, patients just put it on their wrists. Another great way I like is you can get roller balls. Believe it or not, go to like either Amazon or Bulk Apothecary. These are relatively inexpensive, and you can get drops of lavender or essential oils, but they're going to be placing it on probably a lavender as long as they're not allergic to it. And they can put it on the nape of their neck. They can put it on their wrists, on their collarbones, wherever they feel that need. And the fact that they have that roller ball and they have control over it. So again, it's having them have a sense of control. This is another great way. Believe it or not, you can again get this from either like Walmart, they're like 35 cents a piece, or Bulk Apothecary, which is like my favorite place to go to get things like this. You can just take the wick and you put a couple of drops of the essential oil, and the patients just carry this around. They can keep it in their pocket, in their purse. If you have bins for patients, which most places don't, you can keep it for the patient when they come in. This is just a nice way of them having full control. An even easier way is just put a couple of drops on their bib. Okay, the bib is right here. They can just waft it, and it's a great way of them being able to have that nice relaxed feeling. Or you can put it on a couple of pieces of gauze. I mean, there's so many ways. I mean, you can, I know I have them, a lot of people do. They have the lava rock bracelets, or they have a necklace. You can put it on there. There's so many different ways you can do it. And I'm just going to check this chat here real quick to see. Okay. You're absolutely right, Dr. Dawn. if they have bad BO, yes, you can put it in your mask and help you yourself. Absolutely. So there's so many ways to use it, not just for the patient's anxiety, for sure. So, and then, you know, there's different ways to do it to be able to help our patients. Now, EFT or emotional freedom technique. I'm sure a lot of you know what this is, and if you don't, I just want to review it with you very, very quickly. I'm just going to quick look at this chat. Let's see. Are allergic to citrus? Yes. Some people are allergic, but it touches their skin. Absolutely. That's why you don't want to do it directly. You want to use a fractionated oil, or you use it on some other device. But if they're allergic, you're certainly not going to offer them that. You're going to offer them something different. Or don't even use an oil at all. We're going to use one of our other solutions. So, emotional freedom technique. This is dealing with meridians and patient's chi. Okay, I don't even dare to attempt to talk about this because we have Dr. Dawn, who wrote her a thesis on meridians, talking about that tomorrow, so I'm not even going to go there. But with EFT, you're touching the acupressure points. So Don will talk to you more about what meridians are and all that tomorrow. But you have acupuncture and acupressure. You have acupressure points on the body that if you place kinetic energy on these points, you can actually get a result. Now with EFT, there are certain points on the body that you would tap, like literally tap with your other hand to be able to actually block the signals. Now, this is a study showing we always knew there was a meridian system, but now they're showing proof that there is a meridian system with the premovascular system. Here they did an autopsy, and they were able to show that it's not just by the nerves. There's other parts of the body that have these meridian systems or the premovascular systems in it. Yeah, this was back in, I believe it was 2014. It was a Korean study that showed that it was an actual anatomical system. So we're not crazy. And in Chinese, for centuries, we have been using this, and we know it works, but now we have actual definitive proof that there is such a thing as a meridian. This is a thoracic duct of a rat. That blue dye you see is actually a premovascular system inside of a lymphatic duct. I'm going to show you this video, how that blue line, that's inside a lymphatic duct. That blue line was dyed. That is a premovascular, or the meridian, which shows that it is real. Okay, so those naysayers or people think that, we're a little, off, but here we know it works, and here we have some proof to show that. So EFT tapping, what it actually is like I said before, you're hitting acupressure points. Because when you're thinking about your stressor, whether it be you're upset with your husband, I've used it plenty of times for that reason, whether you're stressed about going to a dental office, or even stuff that's going around us today. We have we have that fight or flight feeling because our sympathetic nervous system is now kicked in. The amygdala is now activated. So we tap on these points, and it'll block those signals, and it'll stop that. So how does it work? The Harvard study is showing that selecting certain meridian points, it decreases the activity in the amygdala. There's two amygdala in the brain, one on either side, and it's about the size of an almond. It's fairly small, and that's where our sympathetic nervous system is. It's the limbic system, actually, and that's where emotions and our fight or flight is activated. So when we start thinking about what is upsetting us or stressing us or giving us anxiety, those amygdala start firing off, and the MRIs can show actually the action in the amygdala. So this is a little bit of a graph to show you how it works. So thinking about my anxiety, I have to go to the dentist. Oh my God, I have to go to the dentist. Oh, for me, I have to go to the OBGYN. I don't want to go. So you're thinking about that. That activates the amygdala in the brain. So now I'm starting to physically feel, the anxiety. Okay, when I start tapping those points, those acupressure points, the input of that kinetic energy on those meridian points is now going to block those mental signals that I am creating from my anxiety. So once I start hitting those points, now the arousal in my amygdala starts to slow down. So now that emotional trigger is blocked. So now I'm restored back to to balance. I'm going to give you, here's actually a study showing that it significantly helps reducing anxiety scores, where they actually had, there was another study showing that when somebody started like an 8, because what you do is you have your patient score where they are from 1, not really anxiety at all, to 10, like I'm ready to run out the door. And you have them do an EFT session. You can have them do it before they come in, or you have them sit, have them do it for a little bit while you're, doing, doctor is still with another patient, and the patient's getting ready, and the assistant's helping the patient get ready for their appointment. They could do this procedure, and they can actually get it from an 8, which is fairly high, down to a 3. And you can have them do it several cycles, and you can get them down to like a 1 or a 0. It's very effective. So everybody does a little bit differently. I don't use the wrist points. I just use the karate chop, which is the side of the hand. I use the side of the brow, side of the eye, under the eye, philtrum, mental labial fold, the collarbone, under the arm, which is like for women, it's right about the bra strap, and then the top of the head. I'm going to give you one cycle of someone who would do EFT. Those of you who know how to do it, awesome, you can do it. For those who don't, you can follow along, or there's ways you can go learn how to do it on YouTube. There's a bazillion YouTube videos. Bruce Yates has a lot of great videos. Also, Nick Ortner, Tapping Solution. Sometimes you have to subscribe to some of his things, but Nick Ortner or Bruce Yates are the ones that I really like, but that's me. So I'm going to say I have dental anxiety. I have a dental appointment tomorrow. So I'm going to have the patient do it that morning or the day before that morning, and then there at the time of the appointment. So I'm going to tap with moderate amount of force on that meridian point, the acupressure point. I have a dental appointment tomorrow, and I know it's going to be painful. I hate going to the dentist. Every time I go, I always have problems. I don't want to go to the dentist tomorrow. I know it's going to be painful. The dentist. Going to the dentist is painful. Going to the dentist is very stressful. The dentist. My anxiety. My anxiety. I know I need to go. But my anxiety. My anxiety. Now, believe it or not, that's just one cycle. You should do 3 cycles. I know people think I'm making it up. I'm not. When I do that for myself, I feel my anxiety going down tremendously. Like I feel just less stressed out. I don't feel as wound up. So being able to learn how to do that for yourself, it was an amazing thing for you to do just for general life itself. But then maybe you'll be able to help your patient learn how to be able to self-control their anxiety in the chair. I happen to like it a lot. So homeopathy. Homeopathy is one of my favorite things to do. Yes, you have to start, yes, you repeat a positive reinforcement. You have to start with the stressor, and then you repeat, because that's why you do 3 cycles. I only did 1. You have to do 3 cycles, then you have positive affirmations afterwards. Absolutely. So you start with your stressor, and then you do your positive affirmations. But I don't want to do 3 cycles now because I'll have you here all night. So I apologize, but thank you for bringing that up. One of my favorite things here is homeopathy. Homeopathy was started many, many centuries ago, but Samuel Hahnemann back in the 1800s really brought it to light. And for most of us who do use it, we know that it's like cures like. I don't know about your offices, we use homeopathy for pretty much everything. We use arnica like there's no tomorrow for a lot of our surgical patients. We use a lot of the anxiolytic homeopathic remedies for our patients right before and also during procedures. Because a lot of our patients do not want to take anything like a Xanax or a Valium, or we don't even have nitrous in our office, because my doctor doesn't want to use it, and which is I'm fine with because I personally don't like it myself. But we use the homeopathy for the patients, and they respond beautifully to it. So there's 3 main homeopathic remedies that we really, really like. There's really only one that we use the most of. But here is a study that's showing or suggesting that It is extremely effective in helping patients. This was a study that was done for emergency medicine. Patients had the arnica, and they had the aconite and all that, and it really helped them get through. About 84% of the patients said that they felt much less anxiety, you know, of having to revisit the ER. Now, the reason why I have the Queen Mum on here is because she goes to the Royal London Integrative Hospital. They, for the most part, she just uses integrative medicine and homeopathy. She doesn't want to use anything else, and she's well into her 90s, and she's thriving and doing beautifully. So the first one that seems to be the most popular is aconite. Aconite is a flower, and the homeopathy is very easy to, let me just get through this chat. Oh, okay, I'm sorry. The aconite seems to be the most effective for somebody who has like sudden fear or a little bit of a panic. So we like to recommend the aconite for the most part. And it really depends on the individual. It could be a sudden onset about an upcoming visit. So we tell them to take it the day before. You can tell them to take 5 pellets the night before. And then you can take it the morning of, and then 45 minutes before the appointment. Also, what you can do is if you have your patient taking aconite, and have them in the chair for a long procedure, you know, if you're doing, you know, lengthy, you know, hour and a half, 2-hour procedures, you can keep aconite on gauze on the side, and if they're starting to get a little agitated, you can just throw it in there. Actually, just throw it in there under the tongue while you're working, so that way you can just keep them calm. You can do it every 15 minutes in the beginning, but again, you know, make sure your patient's on board with that. Now, another one, the gelsemium. Gels is for when you have weak knees. If you have your patient though, oh my God, I'm so scared, I need to run to the bathroom. Like those people that get so scared and nervous, they have to run to the bathroom, they get diarrhea and all that, that's where your gelsemium is gonna come into play. Also, some people who have flu and they feel very weak and all that, the gels can help them, but you know, I'm not here to tell you to do that. But gelsemium is more for your, oh my God, I have the runs because I'm so nervous, scared patient. That's where you're going to use the gelsemium. So you're going to use your 30C. You're going to use 3 pellets the night before, the morning of, and then 45 minutes right before the appointment. All right. So have it a little bit on board beforehand. So by the time they're in the office, they're already pretty calm. It's hard to get them. If somebody's coming into the office pretty agitated already, it takes longer to get them in a comfortable position. So Califas, this is one where you are I think this is something that we're all going to need right now, actually, when we're feeling very overwhelmed. We're physically exhausted, irritable, and just overwhelmed with stress and anxiety and, you know, the unknown, and it's just overwhelmingly, it overtakes us. That's where the Califas, you know, the phosphoric is going to really come into play. And this is something that you would take on a longer basis. You start a 6X, you take 3 pellets 2-3 times a day for a few weeks. And you stop as your symptoms improve. So this is not your instant, you know, not your patient who has an instant need for anxiety relief. This is somebody who is just like on edge constantly, feeling a sense of overwhelm. This is something that they would use. So this one we don't use very often at all in the office. So we use more of the aconite, and then once in a while we use the gelsemium. But the Califas works beautifully. This is another one we love. I'm sure we all know about this one. I love when I had a new patient come in when I was still doing clinical. And she actually told me, she says, yeah, I'm very anxious about going to the dentist. I really don't like it. And I'm like, oh my gosh, well, we have ways to help you. She says, no, that's okay. I already took my Bach flower remedy last night, and I took it again this morning, so I'm actually pretty good today. And I was like, this is awesome. So some of our patients are coming to us already knowing what to do for themselves. But the Bach flower remedies is so easy to do. It can be got, you know, I'm sure everybody has like a Whole Foods, or you just get it online. And it comes in different solutions. You can actually get the liquid, or you can get the spray, which is great. I know people keep the spray in their pocket, and you're feeling a little anxiety, you spray that. It has different flowers that help with anxiety and stressors, like cherry plum. I'm trying to remember all the flowers. I apologize if I can't remember off the top of my head. Let me see if I can have it. Might find it here. Oh yeah, we have impatience. Whoopsie. We didn't mean to do that. Sorry, guys. Impatience, flower, and then we have rock rose and star of Bethlehem, which are cherry plum to calm irrational thoughts, star of Bethlehem to ease shock, rock rose to alleviate terror and panic, and impatience to mollify irritation and impatience. So, sorry about that. This is made actually with brandy, with no alcohol, but you can get an alcohol-free remedy now, because for patients who are pregnant or can't have alcohol. So here this is one of the side effects. You can get nausea and vomiting if someone is taking like Antabuse, like an anti-alcohol. If they can't drink alcohol and they're taking it to help break that habit. And for those who just don't want alcohol in any of their remedies. But Rescue Remedy is a wonderful, wonderful solution. So you can find it in most health food stores, like I said, Whole Foods, etc. You take a couple of drops, 4 drops on the tongue, or you mix it with water, you just sip it throughout the day. I like the direct application. That's just my personal preference. It says on the tongue. I like to do it under the tongue because I'm so used to taking homeopathy. So it's just a great, great solution. Here are the benefits. Improves emotional and mental recovery from shock and trauma. We could all use this now, actually. Grounds for your energy and awareness, helping you focus. Brings calm where there has been unsteadiness. Sounds familiar. Helps you stay focused and centered. Smooth emotional reactivity, helping you act rationally, and enhances emotional and mental stability. So it's a nice, simple way of keeping you on that nice track. And here saying that it suggests that it's extremely effective in reducing situational anxiety, which those of us who've used it know that is very, very true. Okay, cannabidol. We were all waiting for me to get to this. I am not a cannabis educator, and I don't plan on being one, and I don't want to be one. So I'm not going to answer any specific questions about CBD and the THC and all that. I know enough to be able to recommend CBD, which is hemp, for patients who have anxiety. I also prefer it is a clean, pure form. I personally use a particular brand myself because it's been shown to be quite clean. I use it more for pain than I do for anxiety. But when I'm in pain, I have anxiety. So it's just a twofer there. So with cannabidol, you're using, basically it's hemp. All right. We all probably already know this. There's a difference between, there's 3 different cannabis plants. 2 of them have THC. THC is the stuff that makes you high. Some of us may want that, but some of us don't. So we use the hemp form of the CBD oil. It has, for it to be considered THC free, I believe it has to be under 0.03% of THC in it for it to be considered THC free. Now there's different types of CBD oil you can get. You can have full spectrum, you can get an isolate. Full spectrum means they use the entire plant. The isolate is more, they just use one part of the plant, which that usually has the least or 0% of THC, depending on what manufacturer you use. But the full spectrum, you have more benefits than just anxiety relief. This particular one I have now is a full spectrum one. I usually use an isolate. It's really what you're looking for. If you're looking for anxiety and pain relief, full spectrum might be better for you. But again, it really depends on your body and your endocannabinoid system, because everybody has an endocannabinoid system where they have receptors for these cannabinoids. So there's no definitive, like what's good for me is going to be good for you. Not necessarily. It depends on how your body reacts to it. So again, a CBD educator needs to discuss that with you. I'm not learned enough to know, you know, the definitives. I know there's things like, you know, terpenes and all that. I don't know those details, but I do know that CBD oil with hemp, you have your full spectrum and your isolate. Either one of those is very good for anxiety. They have done some studies and they're highly suggesting that it significantly decreases the anxiety in your patient. Again, this is something that they can do in the chair, or they can do it the day before, that morning of, and just before they get in the office. It usually works pretty quickly. I use it under my tongue. It absorbs, and for me, within 10 minutes. Some are actually more instantaneous, like if you vape it. I don't talk about vaping. I don't like the vaping for obvious reasons. But if you vape it, you get immediate results. You know, if you're using you know, the sublingual form, so say about 10 minutes, you start to feel a result. So patients can do it in the chair. A lot of offices are selling it in the office for their patients. They could use it right there and then. There's different brands that you can look into. That's really up to you. I'm not here to suggest any one particular. I just happen to particularly like this brand that I'm using. So here, again, short-term anxiety, that's your dental patient, because they're sitting in your chair, they're anxious, because nobody wants needles and drills in their mouth. Unless you're Steve Martin in that Rocky Horror Picture Show. What's a long, slow root canal? Anyway, so for the most part, there's really no major side effects or negative effects for the most part. Again, everybody is different. Do not, I repeat, do not go by this scale or this recommendation. Everybody is different. You need to start at a certain point and go by the recommendations of the company that you're going to use. And then you go from there. You start at a certain point and then either you increase it or decrease it depending on how your body reacts to it. But this is like a guesstimate of what is a recommendation of their dose. This particular company, those of you who probably already know the company, it's 4 pumps. I started with 4 pumps. I only need 2. You know, as big as I am, I only need 2 to get me where I need to be and comfortable. Okay, so everybody is different, but it's a nice solution for patients who are very anxious. And what's great about it also, it has pain control. So if you have a patient who has anxiety and you anticipate them having a little bit of discomfort from any work that we're going to do for them that day, whether it be scanner root planing, or if they have, you know, if you had to do a little bit of GV, or if you had to do the cord packing, you know, for your after your crown prep, and you're going to figure they're going to have a little gingival irritation, you know, that's another reason why it's a nice idea. Okay. For anxiety and stress, here they're saying 3 drops in the morning, 3 drops during the day, and 3 drops in the evening. Again, these are all anecdotal. It really depends on the patient. You can screenshot this. I mean, it's up to you. You probably would know better your patients than I, but this is a general recommendation. NuCalm. For those of you who are using NuCalm, and if you're not, that may be something you might be interested in getting. I found out about NuCalm a few years ago, quite a few years ago. The doctor I was working for at the time, who was a conventional practitioner, he actually got docs certified in a different state. And then when he came back to New Jersey said, well, sorry, but you can't use the license here because you got licensed in another state. Yeah, talk about money grab, but here we go. So he could not use his doxidation. So I was like, well, I'll be damned. We're going to try to find something for these patients because, you know, we have to help patients who have anxiety, and we have to give them something in the chair. So I found the NuCalm relatively not that long after they had developed it, back in 2002, I believe. And he didn't want any part of it, but I was so intrigued by it because it used something that our body produces already, and that is GABA. So let's talk a little bit more about what it is. So basically, it is using different systems. You're using GABA, which is what you produce when you're starting to fall asleep. When you're laying down and your body's just getting that, you're ready to fall fall asleep feeling, that's your GABA. All right. So your body produces it naturally. So that's that little bottle here, that cream. And then you're using a electrical stimulation to be able to get that GABA into the bloodstream. And they're using binaural beats embedded in music. So the combination of the two, you're relaxing the patient and you're getting those brain waves to slow down. It actually causes the heart rate to slow down. And those patients are in a beautiful, almost a monk-like meditation state. And you can work on them. They're fully aware of what you're doing. They're not out cold. They follow directions. They stay awake. Some of them fall asleep because they're so relaxed, but you're able to work on them and they follow directions. And when they're off of it, they are on point. And actually, they have lasting effects for quite a few hours afterwards. They feel very calm. I had one patient when I was still doing clinical, I was doing hygiene on him, and I knew that he was an anxious patient. I'm like, Steve, you want me to use a Nucom on you? And he's like, yeah. So I did the Nucom for him during the hygiene appointment, and he literally fell asleep. And the man never fell asleep during my cleanings. He fell asleep. And when I was done, I took it off him. I'm like, so how was it? He goes, wow, man, that was better than any Dead concert I had ever gone to. Now, for those of us who have been in, that generation, you can take that any way you want. But yes, he was pretty relaxed. He felt very comfortable, which I was very happy because I was able to do what I needed to do, and he was able to get the service that he deserved, and he was comfortable. So a little bit more about what it is. It allows you to be able to work. The patient is not going to be gagging. You're not going to have those tongue movements. It causes a very deep relaxation. Reduces the amount of anesthesia you even need. And it improves healing and pain management because when the patient's not stressed, now what did I say earlier? Stress causes inflammation and it can actually cause a lot of problems in the body. So your body's going to heal better if you're not stressed. So this calming modality is extremely effective in many, many ways. So here we go back to the sympathetic and parasympathetic. We want to engage or activate the parasympathetic nervous system when our patients are anxious, because that anxiety, they can't listen to us, they can't pay attention, they're not going to focus, and it's hard to work on them because their tongue is everywhere, the lip is fighting you, and so we need to kick in that parasympathetic nervous system. And that's how we do it with Nucom, is because you get a rapid induction of the parasympathetic hypnagogic dissociative state. Sorry about that. Because you're able to lower that brain wave, lower that heart rate by using GABA and binaural beats. So you get a steady parasympathetic reaction because as long as you have those headphones on and you're getting those hertz through the brain, you're slowing that brain waves, you're going to keep that patient in that parasympathetic state for that period of time that they're on it. Oops. What's great about it is they're going to get a rapid return to functional state, motor skills. That's what I was saying before. They're in a nice, relaxed, meditative state, but the minute you take it off it, they're good to go. They can get in their car and they could drive home without any after effects. Actually, they're going to feel very, relaxed. That's about the only thing. But not relaxed to fall asleep, but like, wow, I don't feel stressed. I feel actually, feel good. So it's a great way to help them. So they get a very rapid decrease in heart rate and respiration rate by exhibiting an increase in vagal tonality. So these biomarkers are consistent with a deep meditative and illustrative of predictable, rapid onset of parasympathetic nervous system. Basically what it's saying is that we get them in a nice calm state, we keep them in there, and then they get back right to normal once we take it off. Here you can see this graph. You can see when we start the Nucom, you see how the heart rate decreases quite a bit. And once you take them off, they get right back to normal. And it's actually a little bit less than when they first started. So they're in a nice, calm state after they've completed the treatment. Here's more graphs showing about the heart rate variability, and then here the relaxation effects. Here's your heart rate and then how low it can go, and then back up once the treatment has been completed. Here's a study showing how effective it really is. So basically, how do you do it? What is done? 4 steps. You use your cream. You use your CES patches. You use your binaural beat music. And then you use your eye patch or dark glasses. We use dark glasses because some people are very claustrophobic, and you put a mask like this on them, forget it, then you're really going to cause a tremendous amount of anxiety. We certainly don't want to do that. So here's your new calm cream. Honestly, I believe it's Dr. Myers. He has his own type of new calm system that he uses. You just get GABA cream, from Amazon or any company. Get GABA cream. But this cream, you put it on their carotids, okay? You can either, here's just showing how GABA, it really affects the amygdala, and it modulates the anxiety. I wanted to show you that. There's some proof there. So you put the cream on the carotids. Either you have the patient do it. I like to do it because it makes them feel a little more relaxed because I'm actually massaging their neck a little bit. I rub it in quite well. I have 1 pump on each hand, and I rub that into their neck. I have gloves on, of course. Then you're going to take your cranial electrotherapy stimulation pads. You're going to take these 2 pads. You're going to stick them together to get them activated, the sticky activated, and you're going to place it in that soft spot right behind the ear. Not on, that hard bump. You want it in that soft spot, not on the occipital bone, right below it. And you're going to put that patch there, and then you're going to turn it on. Patients are not going to feel any kind of electrical stimulation at all. What it's going to do is it's going to help that GABA get the bloodstream. I'm going to show you that in just a second. Now you have your newer acoustic software. Some have actually an SD card that goes into the headset, but the newer version is a wireless. We prefer not to have the wireless because we don't want the EMFs, so we still have the old ones that have the SD cards that we download music into, so the patient has it right here as opposed to using the wireless. It's really up to you. That's the newer system. Then we put the eye patch or the dark glasses on the patient, and then they're really really comfortable. Here, each side is different hertzes. The brain subtracts it, and then they have about 12 hertz. So that is what's going to make your brain waves from here to now you're like this. Kind of calms things down. Okay, I don't like the mask, dark glasses, whichever your preference is. Here is your electrostimulation patches. You can see how it stimulates the brain, and it causes the vagus nerve stimulation. So now the patient has a new calmed state of mind. I've used it. It's amazing. Tony Robbins, who a lot of people will know, he's that big guru, motivational speaker. He is a huge proponent of this. He uses it on a daily basis to help rejuvenate himself because his schedule is so hectic. He needs that time to just get recentered, and he uses NuCalm on a daily basis. They do have units for you can buy for yourself at home. The in-office units are a little more expensive, but it pays for itself because either you can build it into your fee or don't charge the patient, but just having the patient comfortable in your chair, and they're going to say, oh my God, my doctor is amazing, or my hygienist is amazing. I had this thing and I was able to sit through the appointment, and they're going to tell 2 friends who's going to tell 2 friends. I mean, it's just going to pay for itself just because you're offering something amazing to your patients. I'm a huge fan of using NuCalm. Again, the fight or flight, you're reducing the sympathetic nervous system, you're shutting down your limbic system, and it's minimal effort. It doesn't take a lot of time to get it all set up. 5 minutes tops, even less once you get really good at it. Make sure your unit's charged. That's the biggest problem, is somebody forgets to charge the unit and then they're scrambling trying to find, So that's really your biggest problem. As long as everything is put together, charged properly, you can get that on your patient in less than 5 minutes. Let them sit for a few minutes with it on while you're, getting the room ready, and your patient's good to go. Okay, here's some certifications and approvals. And then there's just a synopsis of what it does. Patient satisfaction. It's, you can charge for it, like I said, but it's really up to you. Build it in, charge for it, don't charge for it. It's really what works for you. I know there are holistic doctors that are using it. I believe Dr. Abramowitz is using it. We use it, we find it very effective. Now, these are two things that you can do for your patient, the patient doesn't do for themselves. I'm not going to talk too much about the dental spa. This is actually something that hygienists can get certified. Some offices can get certified, the doctors and assistants, but it's usually the hygienist that does this program because it's actually incorporated in your cancer screening. This is a use of different essential oils and music embedded with binaural beats, kind of similar to Nucom, but you're using essential oils that are pertaining to the patient's medical history. Okay, if a patient has a medical history of cardiovascular issues or high blood pressure or whatever, you use certain oils. Okay, which ones I don't know. I have not had the training, but I know people have had it, and they really like the effect of it. Does not add time to your appointment because you're already doing your extraoral, intraoral cancer screenings. So you're doing an external massage with the oils to get that patient into the relaxed state. But during that massage, you're actually doing your palpation of your nodes and external structures. So it's really not going to take any more time. Patients feel like it's a massage, but it's really not. And it's not a spa service. They feel like it is, but it's not, because you're using medical reasons for your certain oils. So this is a nice thing to get certified. If you're interested, you can contact me. I can get you more information. Deborah Grant. She can always find her online also. She can talk to you about how to get certified and be able to do this for your patients. Since I don't work clinically anymore, I just never did it. Now, to close, this I think is huge if anybody in the office chooses to get trained in Reiki. Whether it be an assistant, the doctor, the hygienist, the front desk manager, the receptionist, I don't care. Somebody should be trained in Reiki in your office. And the reason I'm going to say that is because I can't tell you how many times we need it in our office. One of our hygienists is Reiki trained. I'm trained in chakra balancing, but not necessarily Reiki. It's very similar, so I'm actually going to be getting Reiki trained. It is huge because we have had instances where patients have had flip outs in the chair, like total freakouts. And whether it be because they had sudden dental pain or whatever we were doing just freaked them out so much, they had extreme anxiety, or somebody was very upset about something, a diagnosis they were given, about having to lose a tooth or whatever. Patients had freakouts, so we were like, oh my God, we need somebody right away. And our hygienist would go into the room and she would do Reiki on them. And every single time, those patients were able to calm down, like within minutes. So I think it's extremely valuable. So if those who don't know what Reiki is, it's basically energy. You're using universal energy. It was started in Japan. And you're just the conduit of using universal energy to be able to get that patient to calm, and you're doing it on certain points of the body. I'm not trained yet. My son is trained, and my son has used it for me when I've had pain, especially when I was going through cancer treatment. I had some discomfort in certain things, and he used Reiki on me, and it helped a lot. I don't want to get emotional, but yeah, he was able to help me significantly with using Reiki. So it's using the universal energy, and you'll be able to be the conduit and be able to. It works on the meridian system also, which Dr. Dorn will talk to you about tomorrow. And it's used for healing. It can be used for anxiety. There's no definitive study saying that it helps with healing, but I don't care if there's studies or not. I know it works. I know plenty of instances where patients have had surgery or have had procedures done and they've had Reiki done, and they were far, far ahead of other people that have had the same type of procedure done, far more healing. They're actually using it in hospitals today because they see the benefits of it. My son actually did his capstone project on the use of Reiki because it's becoming more and more popular in the hospital settings. So the fact that we could use something as simple as energy, which is all around, we're energy beings, and we have energy all around us, to be able to be the conduit, to be able to help our patient in that moment of need, to me is absolutely priceless. Never mind all the homeopathy or any of these other doodads that I talk about. Being able to immediately be able to help and center that patient and get them out of that crisis, to me, is just priceless and invaluable. So it helps with centering that patient or clearing, removing harmful energies. A lot of times when I used to do my chakra balancing, or I would do like a sweep of a patient, I would ask their permission. I could feel their blocks, and I would try to eliminate their energy, so I know exactly what they mean by that. You can actually feel their aura, whether it feels spongy or not. And so you can smooth their aura using Reiki. It's so beneficial for the patient, but as a practitioner, it's very fulfilling also. Oops. So here, oopsie. It promotes deep relaxation and relieves stress and anxiety. It promotes pain relief. And a lot of times pain in and of itself causes the anxiety. So it's like, it's a cascade of events. It's cyclical. Eases muscle tensions, and it gives peace of mind to your body. Increased rate of recovery from injury, without a doubt. So it wouldn't be bad idea to maybe do a Reiki session for some of your surgical patients at the end of the procedure, and even make it when they come in for post-ops, do Reiki for them. You know, it's a nice little adjunct. You know, it's like, oh my God, my doctor does this stuff for me, and you know, it's just a nice, just a feel-good thing. Strengthens the immune system, which is something we all are worried about now. So there is a lot of things I talked about tonight, but I feel very strongly about finding solutions to helping our patients without using toxic anxiolytics. I personally am still not okay about putting a whole lot of toxic stuff in my body, and I'm still getting over it. And I'm sure there's a lot of patients that you're seeing that don't want it either. So having different solutions depending on what your patient's needs are is having different tools in your toolbox. You know, one person is they need their homeopathy. Maybe the other person, all they need is just a little bit of lavender essential oil. Maybe somebody needs something a little stronger like that new palm. But having these different solutions, I think, will be a benefit. It's a win-win-win for your patient, for your practice, and for you. Because at the end of the day, the more we serve, the more we get back in return. And that's what I'm about, serving and helping our patients get the work that they deserve and they need. And if this is what we can do to help them, this is I've done my day. I can go to bed tonight and know that I've helped somebody. So with that, I thank you. I hope I haven't bored you. I hope a lot of the stuff you already knew. So at the end of the day, I hope some of these things you can maybe use in your practice.
Does anybody have any questions for Fran?
Thank you, Fran. Excellent presentation.
Oh, I thank you. I try to keep it like simple, not too heavy, because we got a lot of heavy stuff going on.
Amen.
So yeah, we might even need some of this. I actually, I've been using my CBD a little bit more. I've been using my aconite a little more. So it's great stuff to use because we know we're not going to have any side effects from it. So I like it. So I look forward to your presentation tomorrow, Dr. Dawn.
Yes, and I wanna plug the fact that you dentists that are on here, we're going to, an hour before our 6 o'clock meeting tomorrow, we're going to have a presentation for hygienists. Not that dental assistants can't come on too, that's not an issue at all. I don't mind any dental staff, but I want to try to reach some of the needs of hygienists because quite honestly, I'm getting some emails from hygienists that the assistants are not emailing, but some hygienists are saying, my husband doesn't want me to go back to work because now he's worried I'm in a toxic field, which yes, we were in a toxic field before, but we do want to allay some fears. And if you guys have ideas, we are really lining up some good speakers, even to reach the emotional. So we're going to try to get someone on to talk to us about the stress level, not like Fran did tonight where we're concerned about our patient. We're talking about ourselves, undergoing the stress right now with having kids at home, trying to homeschool them, trying to figure out how you're going to pay for bills. Your spouse may or may not be out of work as well. So look for these meetings every night and let it be the bright spot in your day. And we hope to see you guys tomorrow.
Thank you, Dr. Don.
Okay, I just wanted to mention, Chia Wu said about, is it the same webinar ID? No, if you go to the paid members IBDM page, there is a separate Zoom link for the hygienists, because that's at 5 o'clock. And it's going to be like a round table, just discussing, you know, what's going on, any concerns, you know, what we can do to help them. Yes, assistants can come too, but if there's a separate link for that meeting, and then there's this link for Dr. Dawn's meeting. So there's 2 separate links.
I have shared the hygiene link with my hygienists and asked them to share it on their hygiene pages that they belong to.
Excellent.
So hopefully they'll get some people listening there. But honestly, when you're at the hygiene meeting, invite those people to our meetings that we're doing, like at the 6 o'clock hour, so that
Actually,
but they may have some needs
of caring from us.
And I have actually, I did I was interviewed on Sunday about ozone. And there are hygienists that were asking about it and this, that. And one of them said, I want to get certified. I'm actually in the process of getting certified now. So I was like, yay. And I invited her. It's like, so I'm going to push it out.
My hygienist passed. Kelly passed.
Yay! Oh, I'm shocked. Oh.
Yeah, Syra's coming. I don't know that she's done yet, but Kelly passed.
Excellent. So, but yeah, so I'm trying to get as many of the allopathic crowd in as possible. So I'm trying. So
yeah, we are too. All right.
Guys,
All
we'll
right.
see you tomorrow.
Fran.
Good night.
Bye. See everyone tomorrow.
Good night. Thank you.